And it's loading. All right, perfect. And we are live. We are live here on Facebook and on YouTube itself. Hi, everyone. Welcome back to our next series of webinars. We are waiting for a little bit of folks to get in, so we will just chit-chat around while everyone starts to load in there. All right, Tabitha, how are you doing today?
I am doing wonderful. I've had plenty of coffee and I'm good to go.
You're ready? You're prepped and ready for that?
I'm ready.
All the energy for the senior kids right there.
I got a Saturday energy, so, you know.
Well, that's the most important thing on there. All right, looks like we are starting to get people filter in and go from there. Hello, folks. Welcome. I know, this Tabitha Kucera has been with us. She was with us on Cats and Coffee. And folks, we are so excited to have you all with us today. I know we've got your comments, either from Facebook or from YouTube. Just put those in there and we'll be able to talk to you and get back, as this is a very, very casual talk to help everyone understand a little bit more about senior kitties themselves. Now, just as a starting, I'm going to go ahead and introduce Tabitha, the fantastic Tabitha Kucera, who has decided to, or who's helping us out to talk about how to really help make your friends for life, your cats, your older cats, more comfortable as they start to age. You know, as cats are fantastic at hiding some of their problems, and understanding how they communicate those is important as we continue to make our homes as welcoming as possible for them. Now, with Tabitha has always had a strong connection with animals, and she grew up with a variety of animals, from cats to dogs to turtles to rabbits. And after that, you know, with all of that, she decided to become a veterinary technician. Now, this, you know, you know, there's so much to your story. I'm not going to try and tell your story myself. I would love for you to go ahead and kind of help us introduce Tabitha yourself and how you got into really helping these older cats and understanding them.
So yeah, I loved animals my whole life, and I became a registered veterinary technician because I was like, I can have a career in taking care of animals and helping their humans. This is awesome. And then as I worked in veterinary practices and shelters, I love dogs too, but I have a really strong connection to cats, because I'm sure all you lovely cat people know there's a lot of stereotypes and misconceptions about cats that unfortunately result in some pretty not great things, like them maybe getting euthanized or relinquished, or being told that they're like mysterious or aloof, all these silly stereotypes. And working in veterinary practice, as he mentioned, cats are a lot more subtle with their pain and illness. So I would actually meet a lot of cats and euthanize them on the same day. And it wasn't because their moms and dads weren't amazing. It's just by the time they would know that their cats weren't feeling well, they've been sick for a really, really long time.
Yeah.
And that's kind of what kind of got me into behavior, because I was like, I want to help these people. This is a problem all around the place. So I taught myself more about behavior. I became fear-free and low-stress handling certified, and I became a certified cat behavior consultant, because a lot of the changes we see in cats before lethargy or your cats are just not eating, they actually have behavior changes before. So I've really kind of wanted to do everything I could to share with clients what pain looks like, what illness looks like. And of course, we tend to see that a lot in our senior kitties, who are near and dear to my heart, because we all think about senior dogs, senior people, and things we can do to make them more comfortable, because they can still live their best lives, but we just need to change a few things up. And I noticed that a lot of people weren't aware of like the really simple things they could do to help their senior cats be more comfortable.
Absolutely. You know, and that's such a great barrier to entry. You know, in the vet clinic, so often, as you mentioned, we have cats that are coming in for very, very serious things. You know, as particular older cats, there's a lot of diseases that can run on there. And a lot of times, I think in clinics, we don't always spend the time doing those educational, you know, kind of those small educational, little educational kind of that really change a quality of life, because there's so much pressure to constantly be concerned about these bigger disease points. And so, I mean, I know you, and so you also take some time to do lectures and other things about this, right?
Yeah, so I lecture at conferences. I was actually supposed to be at HSUS Expo right now, but we are all safe in our homes, which is awesome. So I get to lecture about all things cats and dogs, and I have a senior cat lecture, cat training lectures, because I do a lot of cooperative care with cats, because I know a lot of people struggle giving their cats medications or taking them to the vet, and I help clients and their cats actually enjoy the vet or enjoy their medications, and I swear it's possible.
You're not just telling
I know it feels like magic, but it's real. I promise.
Oh, perfect. Well, let's start to move a little bit more into kind of the meat of these. You mentioned there's a lot of really simple things. Well, but let's start at the beginning before we even get there. One of the classic things, and what you've always, and what you've kind of told me a little before, is also, age is, how do we describe age? Old age. What is old age?
That's a great question. So I always say that age is not a disease, because I think a lot of us say things, even about humans, but we say things like, my cat's old, it's normal that she doesn't play. It's not. Or we kind of say, my cat's missing the box, that's just because they're older. And again, age is not a disease, and there's always a cause to those things, and we can help them. And usually we start to see aging changes in cats about 6 or 7. But I know the American Association of Feline Practitioners considers a cat a senior at 12. I consider a cat a senior at 7, because that's when we start to really notice some of these physical changes that you guys should be aware of, so you can watch out and get your cats the best care they need. Absolutely.
And like that, the 6 to 7, I love that idea of starting to think about how we transition. Because if we think about ourselves, I mean, I'm not fit and spry. I'm not fit and spry as I was in my 20s there. Even, it's, everything's already starting to feel like it slows down a little bit more. And when we start to describe cats at age 12, that really is much further down that life path than normal. Now, I'm going to share this real quick. I know we've got Tabitha's been some great and had us little slides for us before. And so this, of course, is our age is not a disease slide on here. I'm just going to kind of, I would like to keep myself on camera from there. Let you, I know if there's anything else you want to cover on that, but we can always move on to the next little slide as well.
And that's what I like to say, cats are individuals and experience aging in their own unique ways, because again, I think we all know cats are individuals, but sometimes we're like, there's no way my cat has blank, or my last cat didn't have blank, so this cat can't have blank. And we need to remember, like, I have 5 cats who are all over the age of 7, and they have all have some underlying medical issues and underlying pain, and we treat them all differently, because even though they have similar types of pain, arthritis, these meds may not work well for this cat, and these meds may not work for this cat. So it's really important to remember that your cats are individuals, and the same thing may not work for every single one of your kitty cats, which is why you work with your vet and assess and reassess and give them updates. We love updates as veterinary professionals. They're our favorite.
We do. We promise you're not taking our time or making us worry. Like, those little tiny updates of how they're doing really helps maintain that best quality of life and course of care that we can as well. Now, you talked about the pain. You talked about these little different bits of pain from there, and kind of what can people start to look out for when they are thinking about chronic pains?
So usually I tell my clients to find out what their cat's normal is. So you guys know your cats better than I do. I would recommend figuring out your cat usually likes to play with this toy, likes to sleep in this place, likes to greet you at the door. And if you notice changes in their normal, that's a big red flag to let your vet know, hey, my cat used to love sleeping in this place. And now, now to come think of it, she hasn't been in that cat tree for like a year. That's weird. Or she's withdrawn now. Now she hides under the bed. Or she's missing the box. So, for example, this wonderful slide, behavior is key. So usually what we look at is maintenance of normal behaviors. Is your cat still doing their favorite things? Like, again, I kind of touched on this earlier, but your cat not playing is not normal. I hear this all the time. And when I'm 70, you guys, I'm going to still be rocking it. And I'm going to still be playing. They might be different, but I'm still going to be playing. So sometimes I'll see a senior cat, and instead of chasing the toy, they flop over because it kind of hurts to stand up, and they play like this. That's okay. That might be a sign that your cat has some pain, though. You should still play with them. But it's really important to watch for maintenance of, are they doing their normal things? Do they have a loss of normal behaviors? Are they missing the box? Are they eating a little slower? Are they not eating? Are they missing a meal? Yeah. And then development of new behaviors. Like my cat used to love the sibling cat, and now she hisses at her. Or she used to love being petted, and now she bites my hand or stares at my hand when I pet her or runs away. So all of those can be underlying signs of pain.
And now when we talk about these chronic pains, where is this source of pain generally coming from?
So generally, there's lots of causes to underlying pain in kitties, of course, but what we most commonly see is arthritis and degenerative joint disease, which is basically arthritis. We tend to see it most commonly in the coxofemoral joint, which is back here where your cat's hips and where your cat postures to defecate, goes to jump, all of that stuff goes to get into the box, climb stairs. Most cats over the age of 7 have some form of arthritis in at least one joint or more based on a lot of the research that's recently come out. And I can say all 5 of my cats have arthritis. I'm not saying your cat does. It's just very common. It's a lot more common than people think. Yeah. And we tend to see it in those rare hips, but we can also see it throughout the body. And then the other most common sign is oral pain. So not most of you aren't looking in your kitty's mouth, which is appropriate. I don't expect you to be like, let me look in there every day. But cats can have really significant dental disease. And that's why vet visits are so important, because part of the exam is taking a look at your cat's mouth, letting you know what the teeth look like, what the gums look like, because cat oral pain is no joke. It really hurts. And they'll still eat, even though their mouth really, really hurts. So that's a really important thing to remember.
Absolutely. Now, you kind of mentioned the vet visit on there, and we, of course, are huge advocates, always pushing folks to remember to talk and call to your vet. Do you think about, what do you think about changing the schedule of the vet visits as your cat starts to really get up in that senior time frame? Is there anything worth kind of like, what do you expect when our cats are getting that 12, 15 plus over there?
That's an awesome point. So ideally, I would recommend cats go to the vet twice a year. So we're going to see them every 6 months when they're senior kitties, because just like humans, they're more prone to having disease processes and changes in their body. And the sooner your vet and you can find those things, whether it's a kidney issue or pain, the sooner we can get your cat feeling better. And in some cases, we can treat it and manage it. And in some cases, those things can be prevented. So I'm a really big fan of cats going to the vet twice a year, and then also getting blood work to kind of check out how their internal organs, because their kidneys aren't like, hey, something's wrong with me. They don't really talk like that. So the blood work really helps your vet understand what's going on with your cat's internal organs, how are they functioning, how are they doing, and then we can address any issues, as well as blood pressure. Blood pressure is super important for senior kitties. Because there's a lot of disease processes where we'll see elevated blood pressure. And that's a big sign for your vet to be like, I'm putting these things together, and this is this kitty's diagnosis, and now we're going to get that kitty some help.
Yeah, absolutely. And that's, we love to say that as our cats get older, just like us, we need more and more appropriate, kind of more timely visits, because things go wrong more easily, and things can go wrong more seriously as well.
And it's really important for the other thing, because you mentioned as a vet, we see this all the time. We see the kitties when they're not feeling well. So like, it's super important to call your vet, but your cat's hiding and not eating. But ideally, those preventative every 6-month appointments, we're also getting blood work so your cat and your vet can know what your cat's normal is. Because if your vet only sees your cat when it's super sick, like for example, one of my cats has a low white blood cell count, that if a vet who never met my cat saw that, they may think of specific disease processes versus, oh, my vet has baseline blood work to look at and knows that that's a normal part of my cat's health. So it really helps that vet get the answers they need. And we want to do everything we can to help our vets.
Well, and this brings up a lot of what you talk about, as being a catficate, here. And I love that term because it helps. All of our cats are unique in their normal, so much unique in their normal, and our owners are really the best source of information that begins to give us clues. And so I'm just going to let you kind of continue to talk a little bit about how these pain and symptoms of pain may change that normal as well.
Yeah, so it can be really important to, again, advocate for your kitties, because even if your vet's the greatest vet ever, it can be really hard, which I'm sure all of them are, it could be really hard to find pain. Same thing with humans. If you have chronic pain, hopefully none of you do, but if you do, you probably have to go to more than one doctor, and you probably have to really advocate for yourself. This is the case for our kitties too. So knowing the changes in your cat's behaviors, hey, my cat's missing the box, hey, my cat's irritable all of a sudden or appears more irritable, instead of just saying they're a grumpy cat, which I'm not a fan of that term. Why aren't they grumpy, right? Because guys, chronic pain sucks and it makes you more irritable. It makes everything harder. So you really should do what you can to advocate for your cat. And then also, I think every vet exam should include 2 to 3 videos of your cat's acting normal. So what I mean by that is we all love videos of our kitties. So you just take a few cash videos of your cats doing their thing, whether it's sleeping, playing with a toy, going upstairs, and that should be part of your cat's exam because, again, most cats are examined in their carriers, which is wonderful because that's better for them. But most vets aren't like, hey, kitty, walk up and down the hallway so I can observe your gait, which is appropriate. Your vet's doing the right thing. But because your cat will probably be too fearful to walk up and down the hallway, and fight or flight, so being scared actually decreases pain perception. So even if your cat has tons of pain, it might be really hard for your vet to find between them being fearful and then also prey and predator animals. So those videos let your vet see, oh, your cat has a slight, how many limps I see, slight little gaits that are off based on videos of the clients I work with. And then I get to tell their vet, and it's this awesome thing. So your vets get to see what your cats act like in their home, where they're probably a little more likely to show those signs of pain that may not scream out to you or to your vet at the exam.
And I love, this last bullet on here, the every vet, the 2 to 3 short videos of your cat acting normal. I absolutely love that. We see, like you mentioned, so many of the animals that come into the clinic are in that fight or flight mode. And cats are particularly prone to those extra stresses over dogs from there. And so that increases the risk of them hiding and just not communicating to the veterinary professionals appropriately. And they don't, when they're nice and comfortable in their home, they can really help let that guard down a little bit more. So I think this honestly should be an inclusion with every single vet visit that we constantly see. So how did you, from the 2 to 3 short videos, where did that start to come from as an idea wise?
Honestly, as a veterinary technician, I didn't think of any. I'm not gonna lie. I didn't think of a lot of points until I got into behavior, where I'm obviously still a vet tech. Because that's another thing. A lot of underlying behavior issues are either caused or contributed from a medical issue, because behavior medicine is the same thing. They're all together. So I had my clients start to take videos of their cats even after I saw them in their home for a consult. Take videos of your cat's gait. I just want to observe it, because I started seeing, now that I saw pain, I'm like, it screams out at me. But even as a vet tech, those are things that I didn't notice necessarily when I was in a hospital setting. So I realized how many things I saw in homes, and I'm like, no wonder poor vets are having such a hard time diagnosing and managing this pain. And why? Because a lot of cats have pain, and only 8 to 10% of them, based on the research, are getting treated. And that's not because your vet isn't amazing and you're amazing, but it's because cats are really subtle with some of this stuff, and those videos can make such a big difference. And who doesn't want to share a video of their cat?
I mean, we all have them. We all have them.
Exactly. Most people already have them, which is I love that you guys love your cats and take videos. But then your vet can also see your setup. Like, oh, like when your cat scratches, for example, instead of your cat scratching like this, I see a lot of painful senior cats, they scratch and stretch like this. They don't do that full, or when your cat wakes up, they don't do that beautiful, I don't do yoga, but that beautiful yoga stretch. They do like a mini stretch because it hurts to stretch. So like subtle things like that I honestly didn't see. And now that I got a lot more into behavior, and I have the awesome pleasure of going into people's homes and meeting hundreds of cats, and then seeing them in veterinary practices and shelters. And I've gathered a lot of things that many people don't see as pain. And once I point them out, the great thing is the clients then see them. They're like, I can tell that my cat has pain. And then even if your vet gets you on pain medication, your cat on pain medications, you can then tell your vet like an accurate update. Because we all know, as a vet, when a client says my cat's fine, guys, that doesn't me saying to my husband, I'm fine. You guys, I'm not, when I say that to my husband. You probably aren't either. So just heads up. So it can be helpful because you can be like, my cats, we started pain medications and we seniorified the house. And then you as a client now know what pain looks like. Because how are you supposed to say how the cat's doing on pain meds if you don't know what the signs of pain are?
Right, absolutely. And those, we've talked about a lot of the different signs of pain. I know with these slides, we kind of have already covered a lot of these different areas of where we assess all these behaviors of pain, from the mobility, these playing, these eating, drinking, even the resting and relaxation on there. And so I think the next part we're going to move into how we take this pain and we take this understanding of pain and seniorify the home, like you mentioned on there. Now, I'm going to stop you real quick, folks. If you do have questions about anything we're covering while we're doing, please drop them in the comments. We'll get to them right at the end. We'll be able to talk on specific points. So please start dropping them in there, and we'll be happy to keep on getting to those. But yeah, so seniorifying the home. Seniorifying the home. You mentioned that. What does that really mean?
So I love cat enrichment in general. We've all heard of catifying your home and making your home more cat accessible. Like I call it a feline friendly environment. But again, as we age, for example, I may need some bars in my house to help me not trip, and that's okay. I may move into a ranch without stairs. So we seniorify our homes for us. But again, these are things that I often don't see because people just aren't told or don't think about it. And there's really easy things you can do to seniorify your house because your cat may have some pain. Your cat may be moving slower or may have some urgency when it comes to going to the bathroom because of kidney issues or diabetes or one of those underlying medical issues that we commonly see in senior cats. So there's a lot of really great things that you can do right away to help make your cat's environment more comfortable as they age. So here's there's quite a lot of tips on here. I mentioned routine. You guys have probably already picked up on this, but cats are super fans of predictability and routine. So are we, which is why many of us are going a little crazy right now because our routines got mixed up with this whole thing that happened. So with your senior cats, as cats age, change is harder for them to take. That doesn't mean you can't make changes. Like if you have to move or if you're having a beautiful baby or some big changes happening, I understand that, but be aware that that's going to be hard for your kitty. And let's do everything we can to keep that routine. You're going to get your scheduled playtime. You're going to get feeding at this time, cuddle time around this time. So you have some sort of routine for your senior cat because that will make such a big difference for them.
And I mean, it's just that predictability of where they can go. And I think we see that a lot in, I see it a lot on the clinic side as well, is where you start to really just almost feel like the cats they're just not as comfortable as they used to be. And I think that a lot of that rolls down into routine, particularly around children as well.
Yeah. So besides just having more resting spaces for your senior cat, because I'm 35 or 36. Oh, it's just my birthday. And I'm not that old, but just like Dr. Chris mentioned, I need to rest a lot more than when I did when I was 20. I need a lot more resting spots in my house. So your cat does too. And this can be literally a cat tree. This could be a heated cat bed. So heat is your cat's friend. I'm sure you guys, some of your cats might even seek heat. So if you have a senior cat and their joints hurt, heated cat beds are life, you guys. And you can place those in your favorite resting areas. So like, for example, when it comes to your cat's resources, food, water, litter boxes, heated cat beds, all that fun stuff, they shouldn't be in a guest room or in the basement, right? They should be in areas that you are, because our cats love us and they want to be where we are. So ideally you would have them in your living room and bedroom. That's where most people hang out, but wherever you hang out, and they should be easily accessible, because if you have a senior cat, even if they don't have an underlying medical issue, I'm 36 and sometimes I don't want to go upstairs to pee, guys. So asking your senior cat, who most likely has pain, it's very likely, to walk up and down a flight of stairs every time they have to pee, that's rough, you guys. That's really rough for them, which is probably why I'm sure Dr. Chris has too, but we see a lot of senior cats who miss the box because it's just too hard physically for them to get in or to find it or get there in time, basically.
Absolutely. And, particularly around areas and homes that have basements, a lot of times the litter boxes get put down in the basement just to remove it from the common living areas of the humans. And those can be very difficult. The cat knows it needs to make that. That can be a journey. That starts to become not just like a short jaunt. That is a journey that needs to be prepped and prepared for on there. Now, when you talk about these changes, though, I know it's kind of mentioned in the last bullet here as well, but how do you go about instituting these changes?
So I mentioned, like you said, gradual, because even positive changes, and this is true of humans too. I'm not saying, hey, take all your cat's litter boxes and make senior feline friendly litter boxes tomorrow. So for example, as far as gradual, you're going to keep your cat's box, maybe their older box where it is, but you're going to add a feline friendly box near it. And to be honest, most of your kitties will probably quickly make the choice to go into the box that's more appropriately sized and easier to get into. But that way it's their choice, because guys, we don't like being forced to do things, and neither do our kitties. So when it comes to making changes, if you have a cat tree that your cat really likes, but maybe can't get on anymore, I'm going to put, stairs or even a dresser or something so they can get on it easier. So we're not necessarily taking things away and replacing them. We're just making the things that they like more accessible and easier to use.
And I think that's a great picture that we have right on this slide right here of these kind of little cat stairs. This one is going to the bed on that standpoint, but that idea of making it more accessible and making those stairs smaller, because no matter what, the cats always have this this image that we grow up with them where they can make these huge leaps, whether it be from, and I know Mandy and Yoda are here, like Yoda will jump from the floor to the top of the door on that standpoint and things like that really get going. But that jump just doesn't occur as much anymore.
Yeah, and a lot of people are like, my cat still jumps, he doesn't hurt. My knees are really bad. I'm a vet tech, of course they are. And I still walk and run and jump. I don't have a sign that says I hurt. So it's really important to realize, now, does your cat stop for a second before they jump? Because cats are agile, beautiful creatures. This is a jump. If they stop for a moment, that's pain. It can be anxiety too, because context. But some cats will actually just sit at the bottom of the stairs and stare up, or sit and stare at the cat tree because they're like, I really want to go up there, but like, I really have to think about this and it hurts. Okay. So even if your cat can jump, like I can jump and move-ish, but I'm still going to, when it comes to me jogging, for example, I'm going to go on a slow run before I do a 5K, because that wouldn't set myself up for success. So by offering like easy ways for your cats to get to their favorite places, you'd be surprised. They're going to take advantage of those. And why not, right? Make their lives a little easier, for sure.
Oh, absolutely. And while you mentioned favorite places, and we talked a little bit about litter boxes themselves, I know they may not be the favorite place, but they certainly are a necessary place for all of our cats to get in and out of. So how do we make those more accessible? Besides just bringing them upstairs, how do we make the box itself a more senior-friendly cat box?
So it's a bummer because the boxes that are mostly out there for sale, unfortunately, are way too small for kitty cats. As you guys probably know with cats at home, most cats may get litter everywhere because they actually have to come out to do the scooping part. And then they get it all out of the box because they physically can't scoop, poop, scoop in the box. They can't do the things they need to do. So ideally, a litter box should be 1.5 times the length. And this isn't only for senior cats. This is for all kitties. So I love Sterilite containers. Guys, they're like $5. I see litter boxes out there for like $40. And I'm not sure who they're made for because they don't make them for kitties. So Sterilite containers are a great option, or this one on the bottom is just an under the bed storage container, which us in Ohio, we have summer, spring, winter, it's all over the place. So you have your sweater storage containers, you could just throw some litter in there and then it's just easier for them to get into. Or you see these ones at the top where you may have some cool tools. I just take a blow dryer and warm it up and then cut it with an X-Acto knife. And then this is a client's, she put fun duct tape on hers. And then that one's from my living room, the gray one.
Right.
And that way the cat, instead of having to do this, literally, they could just walk in like this because guys, they have a lot of pain. You might even notice your cat might not posture when they defecate or pee. They might just go like this because it hurts too much to do that. So I want going to the bathroom an everyday function that they have to do to not be hard, right? So a really great thing you could do is use a low entrance box that's appropriately sized. Ideally, place them in areas where your cat spends most of the time. So this is my office that I'm in a lot of. I have a litter box in here. I have them in my living room because, again, that's where I'm at. I have one on every floor because I have 5 cats. And I want them to have choices. So I do have a box in my basement. I'll be honest, guys, it doesn't get used much, but choices are cool. I like them. So place them in areas that your cats can easily access. And then I'm a big fan of using like a night light because as our cats age, they do have hearing and seeing changes. And I had one cat who was house oiling, and I'm not saying they're all this simple, but the client added a feline friendly box and a nightlight, and the house oiling was resolved. Poor cat just couldn't find or get to their box, you guys. So there's a lot of really great, easy things that we can do to just make litter boxes and going to the bathroom a not stressful thing for them.
Absolutely. And that, I think we underestimate how much of a stress that can be, because just like us, they do want to go in kind of an appropriate, refined space, but consistent space, so that they know where it's kind of hidden and out of the way from that standpoint. That isn't the only function. While we talk a lot about cats and going to the bathroom as a hurdle as they get older, that's certainly not the only kind of like normal maintenance function that gets kind of affected by all of this, is it?
Right.
I always, in clinics, we can always almost age a cat by the moment it walks in, just by the hair coat itself.
That's a really good point. So as cats age, partially because of the underlying pain issues. Again, I'm going to keep bringing that up because it's so common. You may notice your 14-year-old cat is kind of looking a little wrinkled on the back. Looks like someone maybe fluffed them, but no one did. Or they may even start to get some mats. So, or again, like you may start to pet them and you notice when you pet their back that they look at your hand, which is a sign to stop, as a heads up. That's a sign that they're like, I'm conflicted, I'm uncomfortable, or they may vocalize and meow, or they may bite you because it really hurts and I really wanted you to stop. But all of those, because grooming can be harder as they get older, and their nails, we all know those lovely old cat nails, they get more kind of brittle and big. So, and cats can get their claws stuck on things because they're not doing that stretched and that scratched, because that stretching motion kind of hurts sometimes. So when it comes to your senior cats, helping them with grooming is ideal. Regular nail trimming, daily brushing or cuddle sessions. And then I know I mentioned your old cat is less able to groom efficiently. So you can kind of get a warm cotton swab and just clean their eyes, nose, separate cotton swabs for each thing, of course, and clean around their tush, or they may get a little bikini wax where you trim their back end, or you have a veterinary professional or groomer in most cases, trim the hair back there, because that's another thing with senior cats. Constipation is really common. And a lot of us are like, constipation's normal, their stool's a bit hard. Guys, constipation hurts. It really sucks. Hopefully none of you have had it, but it's not fun. So for senior kitties, sometimes things can get stuck back there. It can hurt to go. And cats are meticulously clean creatures. Humans are cool. Cats are way cleaner than we are. So if their coat is unkept, just like, if I didn't shower for 3 days and my hair was greasy, I feel weird and gross. So does your kitty cat. So especially getting them used to brushing and nail trims when they're younger, because we can pair it with some, hey, I'm going to put some squeezed cheese or whipped cream or churro paste on a plate really thin, and I'm going to brush you for just a minute before that food is out.
Yeah.
I'm going to have you associate getting brushed with good things. I'm going to, if you're running away or going stop, I'm going to stop before you do that. So there's a lot of ways we can help our kitties enjoy brushing. And some of your cats a lot of my clients' cats love being brushed. So we're helping them because they can't groom themselves. We just got to help a bit.
Well, and that, that feeling, even if I get that almost that, like, if we think of it like a massage, which of course not as aggressive as a massage. We always have to be, like you say, very gentle when touching the senior cat. But that feeling of knowing that almost that release of attention, and that release is certainly, I think, something that can be kind of ascribed to our cats that feel like they're dirty. I mean, they have that feeling as well, and so there is that help to really pull that all away from there. But yeah, of course, be very gentle with all of these. I think that's the greatest point on here is the gentleness from there. I mean, there's so much pain that we see, and how much. I mean, oh my goodness, we're starting to get, I don't know if you've seen some of the comments, we're starting to get a lot of great questions that are starting to roll through. So I know we've got a couple little more. I know we've got another. I'm going to move on to the next slide from here. It's really about, as these cats, I'm going to let you take this, of course, though, but it's about how we get these cats we want to still get them around and playing, but what does playing look like for our older cats?
So here's just a few examples, because again, guys, senior cats play too. It just might look a little different. So I like catnip kickers for senior kitties because they're big. They can easily grab them. They're on the floor and ground. They don't have to go to obtain them. So that's a really great thing for your kitties. Or again, a bag or just a box. We all know boxes literally are that simple. Tissue paper and some, like this video up here at the top of the black kitty. It's my cat's favorite toy, you guys. Of course it's free. It's a box with tissue paper, and I hide silver vine or valerian root or catnip, which are scent things that kitties like, or I'll throw a few kibble in there. That's them using their nose. They're exploring. It's fairly, you could do a very low box to make it easier, or literally just give them some tissue paper and throw some kibble in there. They're living their best lives, and that's kind of what a snuffle mat is. So everyone's heard of snuffle mats for dogs. So they're things that snuffle means to nose into. So your dog uses their nose to find these treats and these kind of like fleece-like things. You can do that for your kitty. Toy rotation. So catnip toys, silver vine toys, those toys you have lying around, mix it up. That same box of toys you've had for 5 years. Not that that's the worst thing, but it's kind of boring for your cat. So you can take some of those toys out, marinate them in some catnip or silver vine, and then switch them out. We do toy rotation for our kids because you're like, I'm going to buy you a new toy and you're going to be bored of this tomorrow. So I'm going to hide it and bring it back in a week. Oh my God, it's a new toy. Yay. You can toss treats because I'm also a big fan of puzzle toys for cats. So the bottom of an Easter egg is a really easy, like I had a 21-year-old cat in a consult, and I was like, let's just see. And her mom has never seen her play. And I gave her the bottom of an Easter egg with a cat treat. So just that foraging, she lived her best life. And now her mom hides them around because she made it harder because her cat eat past that first one, you can just hide treats around the house or toss them slowly for your cats to get. And then, of course, clicker training, because all my cats are seniors, and I didn't really get into behavior, guys, until they were older. So I didn't start clicker training my cats until they were all over the age of 8, and they're all clicker trained. And then always, of course, find your cat's preferences. You guys know what your cats like, so provide them more with what they like, for sure.
And yeah, I mean, there is so many options out there now for cat enrichment. I think there's so many great options as well. And really that preference, I mean, some of the biggest barrier actually, it feels like when talking to folks is getting that barrier. They're like, well, you know, I don't want to try everything because I know my cat's not going to like everything. It's going to like specific stuff. But moving through and using, you know, the tissue paper is a great idea for if you want to do that before you do move into a full snuffle mat or things like that. You know, there are, as you mentioned, cats do love the free toys. They seem to have a tendency to really get into those itself. Oh, good. Well, this is, like I say, we've got, all right. I'm overwhelmed with questions right now. Overwhelmed. No. So thank you so much for walking us through kind of this great introduction to pain and how we seniorify cat households. But I'm going to start to kind of throw some questions at you. Are you ready? Are you ready? All right. We're gonna all right. Well, we've got a lot of really great ones. I know one of the ones that mentioned is a little bit of an overarching topic. It's not something that we're fully going to be able to kind of cover, but Ella was asking, you know, about feline dementia. That's always something that comes up. We talk really specifically about pain, but as we also have the cats that get older, what, you know, just some general intro into feline dementia and how to manage that.
That is a really great question, Ella. So cognitive dysfunction syndrome, or we can call it feline dementia. We do see cognitive decline in cats as they age. And there are things you can do to help. So you may start noticing, usually we follow this acronym called DISHA, which I'm sure Dr. Krish is super hip with. And we look into disorientation, like, does my cat forget who I am sometimes? Does my cat just stare off into space? Is my cat sleep-wake cycle off? Like, your cat's waking up in the middle of the night at 2 a.m. and vocalizing excessively. Like, that's not your cat being difficult, which I'm sure you guys know. That means your cat's struggling with something. And those are some pretty common signs that something's off and there may be some cognitive decline. Now, unfortunately, there isn't some magic treatment, as there isn't with anything, but there are things that you can do. There are supplements and specific diets that you can talk to your veterinarian about to help your kitties. And then also with cognitive decline, some of the things you could start doing is a lot of what we already talked about. So routine, consistency, and predictability. Also increasing enrichment. We say, if you don't use your brain, you lose it. This is true of our kitties too. So, hey, I'm going to give you some puzzle toys. I'm going to get your brain thinking. We're going to start easy and increase the challenge based on how your individual cat is doing. So there's a lot of things that you can do to help your kitty and seniorify the house. Sometimes I'll have clients start leaving food, like kibble or treats around the house instead of hiding in puzzle toys. Hey, let's just hide some kibble in their favorite resting spots so they can hunt throughout the night and maybe have something to do instead of vocalize. Again, if they're having some cognitive decline, it could be because they're not seeing as well or they're not hearing as well. And guys, that's scary for a cat when they're like, okay, I don't know what's going on right now. I'm going to meow a lot. Your cat might become a little more clingy and things like that. So there's ways we can make the house more comfortable with a lot of what we talked about. But cognitive dysfunction is definitely something I see commonly in cats. And I actually have a really great article that goes probably way more into detail about it that I'd be happy to share with Dr. Krish after this. Or you can email me at chirpsandchatter@gmail.com because it goes over all the things. And I'd be happy to send that to you, Ella, too.
And we've got, like say, I'm going to put these up a little. I'll put them up now as we talk. There's we've got an Instagram and Facebook at Chirps and Chatter, and then also we've got the website at www.chirpsandchatter.com as well. And these will come up as well. We'll post them with the description and the video from all there, and I'll get that article so that we can have that as the reference for the dementia in our senior cats as well. That is, besides just dementia, I know I'm going to have some real hard segues here to change into different topics on there. And when we talked about seniorifying a home, and we talked about the routine changes that, particularly like a new human child was coming into the household. But what about when a new cat child starts to come to the household as well? Christina has an older cat. His name is Gordo, but she was considering another senior cat. Now I want to do both senior and kittens themselves, but from a stress standpoint, adding both ages of cats. Kind of, what do you think? Are there different tactics that you take for the different ages of cats, or what do you do?
Yeah, so again, it's kind of a broad question, but when it comes to senior cats, sometimes I often see clients who lose cats, which is not easy for anybody, often say, I'm going to get another cat to help my grieving cat. And that's something I am not a huge fan of, because that's like my close friend. I know people are coming from a good place, but that's like a close friend of mine dying, and then someone being like, here's a new best friend. She's awesome. Dude, that's weird. That's because clients are coming from such an amazing place. But adding in a new cat right away is probably not going to help with the grieving process for your cat, if it's specifically for that. And when it comes to, if you have a senior cat, getting another senior cat is most likely best. I'm not saying you can't get a kitten if you have a senior cat, but as you can imagine, there's some different play styles, and it does take a little bit longer for them to integrate. And no matter what cat you get, if you do get another cat, the biggest thing is we need to appropriately introduce them, which that's a really long thing, because a lot of people are like, oh, I have my cat in a safe place in a room for a week, and then I let the cat go. It is not that simple, you guys, because cats are individuals. And honestly, an appropriate cat introduction from a behavior standpoint, when we're doing it correctly, is 1 to 4 months. And to be fair, that seems like a long time, but like I've done it with all my animals, and it's 8 years later, and my dog and my cats and everyone loves each other and sleeps together. So I was like, that was totally worth appropriately introducing you guys. So whether you're getting a kitten or a senior cat, if you do have a senior cat, we probably wouldn't recommend getting like a kitten. Because again, there's some more challenges and it's a little more difficult. But either way, it's really important to make sure you have enough resources. So like all of those cat trees, scratchers, food, water, up. We need a lot more of it. And then reduce that competition and stress. And then also we really need to introduce them appropriately.
Yeah, and that is introductions for cats, to do them fully kind of perfectly take a long time. They do take a long time. And I think that's an important thing, a really important thing that I think it's glossed over a lot of time, is that time period. We talk a lot about how to introduce a cat, but we don't, I think, do a good job as like a full industry of saying exactly how long that will take, because that's a barrier. It's a lot of barrier to that from there. Kind of can be a little intimidating.
Yeah,
now,
it's really hard because a lot of people are like 3 to 7 days, and I'm like, where are you guys getting these numbers from? We have to look at the individual kitty in front of us. So.
Absolutely. Now, we do talk about individual kitties. We mentioned a little before about the trimming nails, and how that's an important part of the whole grooming complex beforehand. Now, a lot of times our cat owners and our cat guardians have not really had a lot of experience doing this, because cats have taken care of it on the scratching post for things like that for so many of the years. And so Claire was asking, do you have any tips about kind of getting a 15-year-old cat who has never had their nails clipped before into the clipping nail routine?
So what I would do, I'm going to break it down into a few steps to try to make it simple. So we want to make it positive, right? So we don't want to do what maybe we would have done in the past, where we physically grab and manipulate our cats and then get their nails cut. Because a lot of people are like, I got my cat's nails cut, but she was fighting the whole time. We just taught our cat that they're uncomfortable and they can struggle and fight, and we're going to hold them down harder, which God, if you were struggling and fighting and you held me down harder, I would fight harder. And then I'm never going to go near you again. So we want to keep it positive from the start. And the cool thing is, since you live with your kitty, so you have access to your cat all the time, we can slowly introduce your cat to nail trims based on how your kitty's doing. So I'm always like, let's find something really delicious. Food is one of my go-tos. So I'm going to find something, you're going to find something your cat really likes, whether it's anchovy paste, churro, whipped cream. Again, guys, I'm talking not temptations, like good stuff. Salad, burritos, and pizza. Same thing first things first, find something your cat likes, because we can assume what our cat likes, but find something your cat will smash up. And then again, maybe place it on a licky mat, which is something you could purchase, or a plate really thin, and then give it to your cat. And then maybe go down your shoulder, your cat's shoulder, instead of just going like this, which is kind of weird. You're going to go down your cat's shoulder and maybe touch a paw, possibly cut one. Now, if your cat's doing this, when you go here, you're going to stop there for that day, because you have tons of time. We're going to keep it going at a pace the cat's comfortable with. And then again, you're going to give them some food, and maybe, okay, she's cool. And what I mean by cool, she's not fighting or running or like, vocalizing. You're going to cut one nail, and then you may cut 2 nails, 3 nails. But basically, if you only cut 1 nail a day, but you keep it positive, when she's 16 or 17, she's going to love nail trim. So really, when it comes down to it, I'm not a big fan of physically holding your cat, which is weird, because I know a lot of us are like, we have to hold them down. But when we do that, they run. They don't really like it. And I want my cats to have a choice and play a part in their care. And they do a lot better when you give them that choice. So basically, like, hey, I'm going to just set up an area. You get a treat in this area all the time. So then we're going to go to that yoga mat or heated cat bed, a comfortable space for them. And then this is where we cut your nails, and we keep it positive. And again, if your cat's doing this, that's not the end of the world. Be like, okay, next time I'm only going to cut 1 nail if she started fighting me after the 3rd one, because we're going to end on a positive note. So I would really watch your kitty's body language, respect it, kind of just, again, no physically manipulating your cats, just allowing them to chill and stand there, because a lot of them will. Because once we start physically manipulating them, understandably, guys, they're like, what is going on? I'm going to run. This is conflicting. And we hold tighter, and then just doesn't go well. So being calm and relaxed, and then also being comfortable, getting a really good pair of nail trimmers, because I'm not a big fan of the guillotine or human nail trimmers. I know some people use those. I'm not a fan of those, because as your cat ages, things can be flaking off and it can be harder to cut. You want a nice clear cut. And when you gently push down on your cat's paw, that nail comes out and you can see that perfect white tip, and then that pink part, which is their quick, which is where the blood flow is. So we definitely don't want to cut that, because that's going to be bad. And if an accident happens, it's okay, but be aware that was kind of traumatizing for your kitty, and we're going to have to take it back next time. So just trim those tips, get comfortable with the anatomy of the cat claw before you, and comfortable with your nail trimmers before you even grab your cat. Because if you don't know how to use the tool, your poor thing, you're going to just be a mess when you're trying to cut your cat's nails. So be prepared, be calm, have really yummy, positive stuff. You can, if you have someone that lives with you, you can have them feeding or playing with the cat. I do that all the time. And again, you're just letting them do their thing and keeping it comfortable for them.
Absolutely. And, one of the things I would also love to say is, don't be afraid to take your clippers to the clinic with you, to have a veterinarian or have a technician and ask them to show where to cut and how to use that tool appropriately. We'd be glad to help and see that kind of initiative going on from there. And like you mentioned, that positive, always wanting to end on a positive note. I think that's so important, not only for cats, but also for our owners. The cats are so good at picking up on our emotions. And if we always end on a negative note, I know we have some comments coming through about, getting nervous about clipping nails or things like that. And that nerves, when you start to feel the nerves, the cat starts going, something's about to go down. Something is about to go down, and I'm not sure I want to be a part of it from there.
And if you're comfortable, that's because like we are veterinary professionals, guys. I can cut nails in my sleep, but that's my job. My husband, guys, if I ask him, bless his soul, that's him. I understand, like he does computer software stuff. I that's not my skill set, and I'm aware of that. So if you're uncomfortable, that's okay. Ask for help, like Dr. Chris said. Or again, I always talk to people about getting comfortable. There's a lot of great nail anatomy things, getting comfortable with cat's nails, how to hold the trimmers before you even get the cat. Because when you're confident in that, you're like, okay, now I can just focus on my cat's body language and keeping this positive and not be as worried about, whoa, am I going to mess this up? Because you love your cat so much.
Oh yeah, and once you get in there, like I say, the routine will be, they will want to, you can really get cats involved in their own care. And I love that statement, the getting the cat involved, allowing the cat to choose to get into its own care. I think we've avoided that for too long. And really that partnership speaks to a lot of the relationship between that humans and cats have. Now, we did kind of talk about a little bit of a stressful situation with clipping nails. We're going to kind of amp this up a notch in a stressful situation level standpoint. And so Eli was asking about, if I can click it right here. Oh my goodness, it's coming back. What about bathing tips? You know, moving from just clipping nails to getting kind of a full bath going on. Particularly as you mentioned that the cats, their posturing may allow for a little bit more poop to get stuck around places as they get older.
So that's a great question. So most cats don't need to be bathed, but of course, if they have stool stuck to their poor bum, and I love that you mentioned that you used wipes. Awesome job. So I would talk to your veterinarian to start as like a baseline. Hey, let's give my cat a bit of a bikini wax party. Let's trim that up just so, because surprisingly, that doesn't need to get done often. And that can get you started off with a great start. So a clean back end. And then what you could do is start working on helping your cat be more comfortable with getting their butt bathed or wiped or whatever it may be. So I would start with that. And then wherever you bathe your cat, so it depends on your home situation, but could you get like one of those Rubbermaid tubs and slowly fill it with some warm water and put toys in it and not bathe your cat? Right? So your cat's just playing with the pong balls. That's a really good water toy. And your cat's just getting familiar with water because again, I'm sure you know this, Eli, that if you put your cat in the water, it might not go well. So basically you could, or your bathtub, if you have a bathtub, you can start with a very small amount of water or just have your cat go in the tub and give them treats. So no water. Then we're going to start to have a small amount of water and we're going to put toys in it and give him his treats still. Like I do the same thing for my dog and my cat. I put peanut butter or squeezed cheese. Some cats like peanut butter. Most of them don't. On just straight up on my bath tile. So my cat can just do their lick thing. And then I might be able to clean their butt with like a shower or something like that. And instead of dunking them in water, as you slowly work up to getting that water higher and higher, which again, if you get a nice clean to start, you could do this once every other day. Just get your cat comfortable with it. Then when it does come time for a real bath, you can definitely use a cup versus like a shower thing and just place gently warm water on the cat's tush and make it fun. But we also kind of equip them to be in water in some positive situations. So it's less terrifying instead of just being like, shh, shh. But I understand you want to clean your cat's tush. So that's and once you get that baseline cleaning, a lot of the times when I'm talking to clients at work, I then say, I want you to get these wipes and I want you to start wiping your cat's tush once with a treat. And then we basically get the cat used to wiping. And since we have that nice baseline where there's not all that fur, a lot of clients can do really well with their cat just wiping their cat's tush instead of full on bathing. But both of those things would be helpful to work on.
Well, and and the biggest thing with all of this, you mentioned the gradual steps. This is just like everything we always talk about. We want to make sure that the changes that we're doing or the behaviors we're promoting are done through gradual steps, whether it be these nail trimmings or these, getting used to the bathtub or different areas, whether stressful areas itself. always little bits of positive, I think is why you're so successful with your behavior and with your consulting on there from that standpoint.
And I know some people might be like, that takes forever. But guys, I'll be honest, because I start at places that individual cat is comfortable with, and I assess their body language, and I don't go to the next step until they're comfortable, I see behavior changes in very short periods of time. Like, I work with cats who love the vet now versus we just got it done. I'm going to be honest with you. Yeah, maybe you got it done, but now that cat we are back 100 steps. So now it's going to take you a lot longer. So that's where I think a lot of people are like, it takes longer. But actually, since I'm going at a pace the cat's comfortable with, it goes a lot faster. But I know I see the end parts a lot more, and so that's why I just wanted to make a note on that too.
Well, and it's so important to hear the end parts, to hear the success stories about those, to know that we're working towards a location and getting it from there. Well, the one last question that I have for you, and this is just kind of personally for me, and I know it's so important for people to hear, even though there's not as many vet visits happening at this time, is if you have a little bit of tips of how you help cats get more excited about going towards a vet or more comfortable with going that way. It's such a key part of accessing care. Yeah.
So there's quite a few things I can recommend. One of the things right away is if you don't have your carrier in your main living area, get in there. And if you hold your cat carrier up and your cat runs, that's a pretty severe fear response, right, guys? So that means let's start over. Let's look into buying an appropriate size carrier, ideally one that has an opening on the top or bottom, and a plastic carrier is just fine. We can take the screws apart because we don't want to just wing it and pull cats out of carriers. We want the top to come off. So you can purchase a new carrier and place it in your living room. And it works as an extra hiding space, which is great because all cats need more of those. And then it's not this thing that comes out of the terrifying garage and then we go somewhere scary. So put good things in it, like a shirt with your smell on it. If your cat's really bonded to you, catnip, silvervine, and kind of basically we're getting our cat familiar with this cat carrier and that not always bad things happen. And when it comes to traveling with them in the car, just a few tips, because a lot of cats, getting them in the carrier and getting them in the car is so stressful. By the time they get to us, poor things they're very stressed out. So as a cat owner, again, you can have the carrier in the house. And then when you go into your car, you can cover that carrier with like a Feel Away, which is a cat pheromone spray. Cover that carrier with a towel, because when you're scared, guys, stimuli is intense. So if I can limit that stimuli a little bit, it's going to be better. And then I'm going to play maybe a purr. I have a purr app that I really like, or classical music in the car to kind of set that comfortable environment. If it's winter, because Dr. Chris is from Texas, I'm from Ohio, and it was snowing yesterday. So I'm going to warm the car up or cool the car down before my cat even gets into it. If you guys have lived somewhere where it's cold, if the car's warm when you get in, your fear, anxiety, and stress is severely decreased immediately. And when it comes to carrying the carrier, I don't know why carriers have handles. This is how we carry a carrier. Ride. So carry the carrier like this, so it's more stable. Put it behind your passenger seat on the ground. That's my favorite place because you're not all over the place. And I know we love our cats, but most cats don't like us like poking in and saying hello throughout the drive. They're not big fans. And when it comes to vets, I'm big fans of fear-free, cat-friendly, and low-stress handling veterinary professionals and veterinary clinics, because they tend to be a little bit more familiar with fear-free and feline-friendly handling techniques that are just a little less stress-inducing for your kitty cat. So, for example, if I'm working with a client, the cat goes right into the exam room, and right now we're doing curbside, so you're from a safety standpoint, so your vet will most likely take your cat and bring it to a room right away, so it's not seeing a bunch of dogs in the lobby and people and scary stimuli. So those are just a few tips that can definitely help to decrease the stress when it comes to going to the vet.
I mean, and that's such a, like, once they can get there and get that routine in, it's so great for the cat's overall health to know that it's not a stress and pain point when they are feeling sick and already feeling stressed from that sickness.
Yeah, for sure.
Well, thank you. Thank you so much for all of your time and all of your advice this week on webinar and on Cats and Coffee as well. Like mentioned earlier, you can follow Tabitha on her Instagram and Facebook at Chirrups and Chatter. Right there. And then also on her website at www.chirrupsandchatter.com. Join us, folks. We have another great week next week of guests. We have Dr. Patrick Mahaney, and he's going to be talking to Becky about being a house call veterinarian, in particular in times of COVID, and how to keep everyone safe and how to keep your cat safe from there. And then we'll also be talking to him with a webinar next Sunday, the 17th, about dentistry. So about some of that pain that we talked about a little more, where we talk about dentistry, and then of course a little bit more COVID. So thank you all so much for joining us. It was great to have you here. If you have any other questions, this of course will be on YouTube. We're going to get to your questions if there was any that we did not get to in the comments from there. But everyone, have a great day. Tabitha, thank you again. And I'm going to let you.
Thank you so much for having me. Happy Catterday, everybody.
Happy Catterday. Have a great day.